I think what the government spokesman yesterday was talking about are the 3 cases that we already have, not 3 cases expected. Because, suspected, everybody is suspected, We have urged our people, and we will continue to urge Kenyans, please stay away where people are congregating. May they be weddings, may they be funerals, may they be religious congregations, may they be nightclubs, may they be churches. Please, please, we appeal to you.
That would be a really difficult task, ladies and gentlemen, for the kind of society that we have, not to attend funerals, weddings, and church. I think the emphasis should go on what kind of intervention we have in these places, like churches are now washing hands, giving the sanitizers and all. So that would be a difficult task. But let's talk about our preparedness right now and the kind of response. We have, you said that we wouldn't have done anything further than we have done right now, even then when these calls came. But the kind of response that we have, the first concern is that a lot of people were saying they're making calls, one to the 719, I think. Apart from that, the mobile numbers that were provided, the CS himself said, have got so many calls. Yes. And the intervention is slow. I mean, if those are response team, and that's what I'm looking for from you, what kind of response team do you have that can be called for 4 hours and they will not respond? What is the fear? Why are they not going to the ground?
So Ken, 2 things. The first comment on the level of preparedness, I think it's important that I shed some light as to how some of these patients present and how the disease evolves in the patients. Again, rightly so, we must use data and we must learn from the different countries in terms of how the situation has evolved there. In China, we are told that sometimes the incubation period, the period it takes before a patient is being seen to have, the runny nose and the cough and the difficulty in breathing, can range between 5 to 7 days. Now, the screening measures that were put in place, and this is just in reference to the prior discussion we had, were screening measures that were endorsed by WHO, and were screening measures that primarily targeted, and the thermal scanners. So what happens is that a patient can actually pass through when you have a normal temperature before you've actually started presenting these symptoms. And so to say that we may not have been prepared is actually incorrect, or is inaccurate, because this disease is a disease that some patients are coming in and not presenting up until the 5th day or the 10th day. But then you've raised an important point in terms of preparedness, and you've raised an important point in terms of dispatching rapid response teams. What the ministry is doing is listening to Kenyans, hearing the cry in terms of needing teams to respond rapidly. And so within the last 1 week, we've actually mobilized more team members. We've gotten into engagements with the Red Cross. So Red Cross has given us numbers in terms of response. AMREF has given us another 60,000 team members strong.
Across the country?
Exactly, across the country. And then through national and county collaboration, we actually now have what we are calling county corona committees in all the 47 counties. And these county corona committees have mobilized the health workers in all those 47 counties. And these are committees that are actually being chaired by governors. I'm happy to say that counties have even gone further and put in place call lines and toll-free lines that are county-based. So the 719 number is the number that is being manned nationally. And it's a number that's been manned, again, in collaboration with our partners. Safaricom has come in together, and all the telcos have come in together to support that initiative. Again, in response to the need for us to be more agile and faster, we've now engaged a subset of medical practitioners who are going to come in and sit in that call center. So now we've launched and expanded the call center. And we'll actually have
medical practitioners.
Exactly. So beyond having just the call center operators, we are now having the Kenya Medical Association bringing in a number of doctors who will be sitting there at the call center and responding to Kenya's needs. And then through Red Cross and AMREF, we've managed to get a pool set of ambulances that very soon we'll be able to respond across the county. So we are mobilizing and trying to get this resource basket larger and more proactive.
How many are we talking about in terms of numbers? Let me call them fast responders.
Yeah, so
how many?
So in terms of fast responders, how we're organizing it is we're doing it in clusters. So we've divided the country into clusters and regions, and using the Red Cross, should I say, distribution network, because you know Red Cross is a big quick responder all over, exactly. Yes. So that's infrastructure that we are using primarily. The good thing is counties have come in and said that they're actually going to try and buttress this infrastructure along with the different other facilities that they have within the counties. And most recently, the president has also tasked the Ministry of Interior to form part of this structure and help us in response.
So what is the number? I'm looking at the number across the country.
So in terms of hard numbers, I wouldn't be able to give you, we have 1,000 live bodies, because what we've done is we've clustered them and we keep getting incremental support to it.
So I don't have a static number. But you mentioned specifically what AMREF has given, 60,000.
So AMREF, yes. So AMREF has given us 60,000 community health volunteers. Okay. So these are community-based volunteers who are active, and they'll go to different households. They'll be communicating with the community and trying to, try and put in place prevention messages, and also alert us when there's need to respond. Okay. And that's the tier level, that's the base level for the community health volunteer. Beyond that then now is the national and county structure, where we are having all the health workers being mobilized in teams to be able to respond.
So in other words, we don't have a definite number, 200,000, 300,000, no, 500,000 put on this.
No,
we don't have that.
We don't have that definite number.
Okay. Yeah. Okay. Dr. What difference would it make if the government decided to message this differently? For example, in local languages. And do you think that's something that they need to do, because it's not being mentioned by anyone?
Yeah, I think at this time, and as I had said earlier, in terms of awareness that there is a problem, I think the general public is aware there is something called corona. But how they are now able to respond in terms of behavioral and cultural change is an issue. Because I was just seeing even something as I was coming on the news, and somebody was saying, what is this, border rider, my job is to carry people, is not to check whether somebody has got a problem or not. Now that automatically tells you that that kind of population that is interacting with the other population in terms of communication and all that needs to be reached. And how we are able now to use the numbers that you are talking about that they have been mobilized. Are they actively out there, or are they waiting for a problem to come? I will share with you a little bit on what happened in China, if you allow me, and if time allows. Because if you look at what happened in, is it Wuhan? Wuhan. Yes. You remember there was a social group of medical doctors, young people, who identified this problem.
Yes, right at the beginning.
Yeah, quite at the beginning. And they started talking about it. Yes. And the local authority was informed. But in terms of now informing the national government, and that response took quite a bit of time. In fact, I think that group was even being told to be spreading rumors and malicious and things like that.
And the whistleblower died.
And the whistleblower ended up being a victim of this whole thing. So in our situation, we also need to avoid that kind of situation, to be sure that information is being communicated properly, especially on the professional side. Because on the social side, I think there's quite a bit that has been covered. Now, how that interfaces with the profession, so that we get a proper, the desired outcome. To me, that is where I'm seeing the biggest challenge, because you have talked of all those numbers. Now, how they are able to transform and really relate to what we are trying to sort out becomes an issue. Another thing, Ken Mijungu, if you want to look at this problem, how it came about even in China, it was because of behavioral change. There was a time China was undergoing a lot of famine. So people started eating everything. And in the process, that is now where you find that a population started reaching out to even species or whatever animals that they were not eating. People today say Chinese eat everything, but you must go back and find out why. Even if you go to Korea, you go to Japan. There was a time there was a very big famine in those areas. I'm surprised sometimes we go there and I see things we see as weeds here. It's serious food in those places. So this disease then came in. So changing behavior is what I'm trying to put.
Have we really found the source of this disease? Have we done that?
I mean, it's been linked to to bats, and then it changed a bit
so
to a
that's a definite
pangolin,
link.
and then
Because
to
I
human.
just cut him short.
Yeah.
That's a definite
That's
link.
a definite
Okay.
link.
Okay.
Yeah. That's a definite link that currently is suspected from bats, then to one of the animals which the human beings ended up either interacting with and consuming. And even the current outbreak, if you look at where it started from, that market, is where they do a lot of these wild animal
So when you hear the numbers that she has floated around, you think we are in the right direction in terms of getting ready for even an explosion in terms of the number of patients?
You know, those numbers look encouraging, like when you talk about 60,000.
Yes.
But then we should also be saying, how is it going to be interacting with the population?
Okay.
Are they in centers? Do you expect the population to go there? Or are they going to be at where the person who was talking today, this Boda Boda, who was saying, how will I stop working? You know, balancing between the commercial and the need maybe to quarantine and take care is what we really need to work on.
Okay. Dr. that was a concern of one of the eminent persons in this community, that's Professor Levi Obonyo, who's wanted to know, why are we not messaging this right and taking it to the village? Perhaps in Migori or Kisumu, I like to hear more messages in Kijaluo, for example. In Central Kenya, I like to hear more messages. And perhaps that's government, but I'll ask you also how that is going to help.
I saw Governor Lonyangapuo saying that all the things that the Ministry of Health are saying, they as a county will translate it into Pokot.
That is understandable.
And put it in the local languages. So I suppose what she's calling the county corona teams, this should be part of the mandate to sort of spread the information locally. I think Professor Levy is very right. I think we need to reach out quite clearly to every single Kenyan in the means that they understand best, because also there is a concern. We have our brothers and sisters also who are living with disabilities, either hearing disabilities or speaking disabilities, or they also they cannot see, sight disabilities. So they also need to be reached, because equally they are exposed. They also need to take care of the hygiene. They also need to keep social distance and all this. But fundamentally, I want to get back to what she's saying. I think the measures that have been taken, especially bringing more partners on board, actually is quite commendable. I just want to go back to the practical steps. And now that she's here, I think I would specifically talk for the health workers. You know, practically for a health worker, you may do a lot of messaging, and I think Mheshimiwa said the social things are being done very well. I think the infrastructure was also that there was an isolation. But now practically, if I am a nurse or a doctor or a watchman or a sweeper in a hospital or someone working in the laboratory, what I would want to be done is, number one, that should be equipped with the correct knowledge. So there's a lot of things that are going on in terms of understanding the science of the virus. There's a lot of also other things that are going on in terms of how to manage it. So there's all these trials going on. I think what we have not done here in Kenya is to have a clear clinical management protocol that every single nurse, every single doctor, every single clinical officer, a laboratory scientist, or even from the triage, even from the watchman should know that this is the management. And this is not necessarily the kind of message about keeping distance, about droplet transmission, about cough and sneeze hygiene. This is specifically now in a hospital. What should I do with every single patient who is presenting like this? And the same should happen with, as you said, community health workers, so that there is a guideline for communication, but then there is also a guideline for management. So this has not been done in terms of sensitization, so that we have those protocols very clearly in every single consultation room. The second thing also, which is a big concern for health workers, Kenyatta National Hospital, Mbagathi, and every single place, is I still have my bare hands. I think some of the county governments do not even have quality gloves, for example. They don't have masks. They don't have the gowns and the gumboots. For healthcare workers, what we would recommend is a bit more protective measures rather than just the mask and the gloves, and because especially those who are going to be taking care of the patients. What we have seen in Italy, in Spain, and China, and even the US, that a significant number of health workers who take care of these patients also get sick, actually 20%. And some of them have even died. You mentioned the whistleblower, the hospital director. In the US also we are seeing a bit more aggressive disease in the health workers who actually contracted from the patients who first came to hospital. So for me, it's quite a huge concern. So we recommend that there should be holding rooms in all facilities. Okay. And these holding rooms, what they're supposed to do is that there's a specific team that should be designated, of course, to see the patients, but everyone should be aware of what to do because these patients do not just go to that team. They start from the watchman, they come all the way, even the accountants and the administrators in hospitals, you know. So these holding rooms are supposed to help the health workers who have come into contact so that they can work for like 7 days and then themselves they are quarantined for another 2 weeks, okay. You know. Now, during this time that they are quarantined, because they are not in contact with their families, you have to have a reserve of health workforce. That's why we were very pleased when the president announced that there will be additional health workforce. And we, of course, immediately said there are a lot of doctors and nurses that we can mobilize. Okay. And I think this is something that is very key because those practical steps is what we will see our curve flatten. Okay. Yeah, okay. Because so far we may see the rise, and we, of course, the community measures are very important, the preventive measures are very important, but the practical steps in hospitals to prevent spread. If you are a nurse or a doctor and you are seeing 100 people, and then the first case came, like you saw a patient who later had COVID-19, but the 99 others have also been exposed. So even if you are quarantined, remember there are 99 other people who I saw
out of the 99
who went home, yes. You know. So, so these are real challenges that need to be addressed.